Become a subscriber on Wikisana.
A warm welcome to all our viewers to our series Natural Medicine. Today we are talking to two interesting studio guests. The one guest is Dr. Med. Harald Burgard, specialist in internal medicine. And then we also have one of his patients, who will tell us about her experience with gold implants. So stay tuned. It will be interesting and informative. So, hello and welcome. I should actually start with the lady in the round, Ms. Tanja Klunker.
Hello everyone.
Thank you very much for taking the time to talk to us here and for sharing your experiences with us. I'll just say a quick hello to Dr. Harald Burgard. Nice to see you too.
Hello.
And it is always more informative or always more convincing if you can really talk to someone who can actually report on the therapy method you have used and what it has done for them, or her in this case. And that's why it's always interesting and exciting to listen to someone like that. And that is our focus today when it comes to talking about gold implants. And you use the gold implants in your practice to treat pain.
Yes, for osteoarthritis pain. For osteoarthritis pain in the large joints, in the small joints, in the spine, where a joint is virtually broken, worn out, and people are usually facing an operation, and simply to preserve the organs that are there and to improve the quality of life. Gold implantation is intended to improve the pain and mobility of the joint. And let's hear how that helps people.
And then you'll tell us a bit more about the gold implants. So now to you, Ms. Tanja Klunker. Thank you again for your time. And if you would just like to give us a brief description, what was the problem for you and what was your condition like beforehand? What possible therapies did you have before that didn't really have a lasting effect? We would be delighted to hear that right now.
Yes, of course. Well, it started for me after a Borrelia infection, which I had when I was 20 years old and in 2008. Overnight, the first knee joint simply became swollen. And then they punctured it again and again. So I've had about 20 punctures. Sometimes it was good for a few days. Sometimes it was good for a few weeks. Then the fluid came back, functional limitations and pain. Then about 1 to 2 years later the second knee started. Same game, and so I have always had swelling, pain and inflammation for about 14 years now. High inflammation levels too. I tried conventional medicine. I also took a bit of sulfasalazine and so on, but none of it helped. I then tried a bit of naturopathy to help myself again and again, but I actually walked around day after day in pain and even this bad. If you talk about the scale from 1 to 10, I would say I was at 10, 12 sometimes. Then you run out of energy and can't get your life back on track. Well, and then I saw your reports and had a look and realized that this is my therapy. And then I contacted Dr. Burgard by email and sent him my documents, an X-ray. He looked over it and said, yes, that's something for me. And then we made an appointment. So in January, I decided, in March, I had my first appointment, in April my second appointment, and now both knees are done.
If you say both knees are done, what exactly happened? What did they do?
I came to his practice. Then there was the preparation talk. But then I told him that I had already seen all of his videos. So I was already very well informed. And then we went over to the other room and anesthetized it first. The anesthetic worked, then he came back and we implanted the gold. And then I drove home.
Okay, how should I imagine that? Gold was implanted. I have no idea about that yet. I've heard a lot about it, but right now I have no idea.
I was watching how the young lady did it. She inserted 3 small gold nuggets into a cannula and Mr. Burgard then inserted them into the knee.
I'll tell you all about it in detail later.
All right, how exactly? Right. It is very difficult. The doctor will probably know better. Exactly. So, that was a story of how long?
How long did it take us? An hour and a half altogether.
Okay. And then you went home. So the local anesthetic probably worked first. And how did the pain in both knees continue?
Well, what I really noticed was that after about 7 days my left knee, which was the first thing that was done, the pain was gone. And my head, which was always on my knees. So every step I took, 50 to 60% of my thoughts were always on my knees. Because you're in pain. That's completely gone. And the other knee, the second one, was only done on April 17th, 11 days ago.
Still very fresh.
Very fresh, and since about the day before yesterday the pain is completely gone. So my head is now completely away from my knees.
What kind of experience is that for you, having lived with this story, with this pain, for over a decade?
You feel liberated. You have potential in your head again. So it's actually a miracle. For me, it's a miracle.
Yes, I can imagine that. And above all, it goes so fast. This is not a long-term process where you have to wait weeks or months. Or, in her case, that she had to wait.
Sometimes yes.
Do you have to?
Sometimes yes. So we normally say it takes 3 or 4 months. It always improves in the first year and a half. So it's really quick sometimes. We always have patients who say it's all gone after just a few days. Even in my wife's case, the burning pain in the toe that I had treated was gone after 2 days. And the other pains after a few weeks, and they have also disappeared. But it doesn't always happen that quickly. But it happened quickly with her. That's cool, and it stays that way. Yes, when we met for the second time, for the second knee, you told me what you can do with a leg that didn't work before.
That's already possible with the other one.
Okay. Would you like to briefly tell us what you reported?
Well, what I generally notice. I can stand up. I used to always need my hands to stand up to support myself. When I stand up like this, I can just stand up like this without my hands.
The little things that you only notice when they no longer work.
Or if I just walk normally at my own pace. There is no more pain. And that after such a short time. Of course, I still notice that my muscles have decreased, that my muscles need to build up again. So every now and then I feel something minimal there. But the basic pain in the joint is gone.
You also told me that when you wanted to lift your lower leg while lying down, you could only do so with the support of your hands.
Yes, exactly. Yes, exactly.
And that works now?
Well, I could lift my foot up for you now. That is one. And that's the other. And that wasn't possible before. It was not possible.
Okay. You've reported that this was caused by a Borrelia infection. A long time ago. As a patient, does she now also have to take precautions to ensure that this Borrelia infection does not have an effect elsewhere?
Yes, so let's say if someone has chronic Lyme disease, you should of course always check if they still have it, if it's still active, and make sure that it goes away. The problem with Borrelia is that they feed on hyaluronic acid, among other things. And cartilage consists largely of hyaluronic acid. This is why we see time and again that chronic Lyme disease also leads to osteoarthritis, so to a breakdown of the cartilage layer. And that's why people have the problem at some point. And if the cartilage layer is destroyed, then you naturally get symptoms in the respective joint, which in turn do not go away if you treat the Lyme disease, because the damage is there. And that's why gold implantation helps to get these complaints under control permanently. The Lyme disease itself caused the damage. If it's gone now, the damage is still there. Of course, if you notice that you are not feeling well, you should always look in the background. Is Lyme disease still present? I think she's still planning to watch it at some point. But the structural damage to the joint is there. And you just can't get rid of it. And that's why the gold implantation, so that people can walk again, move freely again, regain their quality of life, and always with the aim of avoiding the need for an artificial joint.
And what can you do now? What you perhaps haven't been able to do for a long time, or what you haven't enjoyed doing for a long time? Is there something?
Yes, Mr. Burgard slowed me down a bit. He said that I should give it time and space, because it won't recover within 7 days, but the pain is gone. And so, what I'm looking forward to, I haven't ridden a motorcycle for years. Getting back on the bike again. If you have no strength, your knee always collapses. There have been no more collapses since then. The stability was there from the moment when the gold was in the knee.
Cool.
Very good. Okay. And of course, it was actually a stupid question. What can you do better now than before? Because even when the pain is no longer there, it's simply sensational. And when you have your head free again for something positive and don't always have these thoughts of pain.
Exactly, sleeping is better. You don't wake up as often when you turn. Banal things. I can put my socks back on higher up and don't have to go down. And yes, you notice it more and more. It works. I'm fine again. The swelling is almost gone. That's also really great now with the left one. So after about 6 weeks, the swelling is now almost completely gone.
Cool.
But that's normal, that the swelling lasts a little longer.
Absolutely.
It was already there before. Well, it was always a swollen knee and now the swelling is going away.
So the swelling is not from the gold implantation, it was already there beforehand.
I understood that.
That's just great for me. Because the swelling has always restricted the function, that I couldn't bend it. And now the liquid comes out and everything is lighter. Lighter and simpler.
That's great. We're delighted for you that we've been able to bring people together with the help of Dr. Harald Burgard and the interviews we've already conducted with him. And that you had such a great success, and you are not the only one. Various patients have already spoken here about the good things that have happened to them as a result of this gold implantation. Then I think that was the most important thing, that the pain is gone and that you have regained this movement. So I would like to take this opportunity to thank you very much for this information, that we were able to hear it from you one-to-one in this interview, that you took the time. And of course I wish you an abundance of life and continued enjoyment of movement, which I assume is this case.
Yes, thank you very much.
Thank you very much. Bye, Miss Klunker.
Thank you, Mr. Burgard.
Bye-bye.
Ciao.
Then perhaps we should just take another look at the X-ray images of MS. Klunker's situation, which we have just heard, and then perhaps it will become all the clearer.
Well, as I said, we've heard that she has Lyme disease. In many cases, Lyme disease causes damage to a joint. And what you can see here is now the left knee joint. This is an X-ray, this is the top, this is the bottom. And then you can see here, this is basically the center here. Here you can see that the joint space has become narrower as it normally should be. You can also see small spikes here. This means that we already have outgrowths of the bone to provide support. You can also see here, this white stripe is also an indication of osteoarthritis. But you can also see here on the other side that the osteoarthritis has already arrived under the kneecap. And this is simply a situation where the joint has already been destroyed. And the more advanced it is, the more pain it causes many people. And then you normally say, well, if the knee's gone, we'll take it out and put an artificial one in. That's one option. As I said, this is now the left side. The right side doesn't look much better. Now you can see that this is inside, and you can also see that the ends are relatively close together. Again, these small spikes. The whole thing is a bit displaced. These white stripes here show the osteoarthritis. Here, too, we have osteoarthritis behind the joint. And then of course you shouldn't be surprised that a person who has this naturally also has pain and swelling. If a joint is not in order, then the body says stop, I strengthen the muscles around it so that the joint is not damaged. Then, of course, every step hurts. Then you think about it, as we also heard from Alexander Glog's mother back then, who once said in an interview that I no longer need to think about how I'm going down the stairs. I just walk like that now, as we walk. But a person who in pain thinks about every step. Do I do the right leg first? The left leg? Or how do I turn so that it doesn't hurt? And when the gold implantation takes effect, it stops. And gold is the strongest anti-inflammatory metal in the world. The ancient Egyptians and Incas already knew this 4,000 years ago and incorporated gold wherever they could. We've seen that they put it in their heads, probably for headaches, they wove it around their teeth, for tooth inflammation, and so on. And we use pure gold, not an alloy, but really pure gold. Not even gold salts that were used in rheumatology. They have an extremely high number of side effects. We don't put pure gold into the joint, but around the joint capsule from the outside. Because when the ends of the joint, the cartilage, come together, it is not the cartilage or the bone that is damaged. They have no nerve fibers, but what hurts is always the stimulus to the capsule, which then closes the muscles around it. And if I now place gold around the outside of the capsule and the gold starts to work there, then, when the gold is in there, cells are dissolved out of the gold ions. This in turn means that the substances that are released by tissue cells and trigger inflammation and swelling are no longer produced. This reduces the swelling. This reduces the inflammation and consequently the pain. We've just heard her say that the swelling was very clear. She really did have swelling like that, but it's already gone after a few weeks. On one knee, it goes back on the other. These are the consequences. And when the inflammation, the swelling goes down, then the pain also goes away, as we have also heard, and then the person can suddenly walk again. Then the person can suddenly put their socks back on, they can bend the leg again. And they can do things that they couldn't do before, that we don't even notice when they are restricted. And that's just fantastic from my point of view. I got to know gold therapy back then and thought, there's no such thing, this is madness. My wife, who has always done research in human medicine but is actually a veterinarian, knew the gold, and she knew that. And when I came home, I heard something about gold implantation, and she laughed and said, we've known that in veterinary medicine for a long time. She just never mentioned anything about it. And this has been available for animals since 1975 and Dr. Kierkegaard started treating people in 1983.
In 1983 already?
Yes, and universities are also researching what can be done. That's why it was established over the years, 2002, 2003, 2008, and so on. Publications were produced in 2011 and 2012 and are still being produced later to see how gold works. What does it do? Is it just the acupuncture effect or is it really gold? They found out it is indeed the gold, as I have just explained, that is at work. And we ask all patients, always have, me and my colleagues who do this. We always ask the patients after 3 or 4 months, we call them and ask how they are doing. And then you learn from the vast majority of people that it is better, that it is possibly and in many cases even completely painless. And if it's still not okay, then we just call again a few months later because we just know it needs time. It works really quickly with her. I usually tell people that they have to wait 3 to 4 months to see a noticeable effect. But experience shows that this improves within a year, or even further within a year and a half. And then people come, most of them come when the joint has to be removed. They don't come at the beginning with grade 1 or 2, they come with grade 4, almost all of them. And then you think, oh dear God, what does that thing look like? And the orthopedic surgeon says, I need a new joint. And yet you can really help a lot of people to get better. And that's what we hear in all our phone calls with people. We make a note of it, we turn it into statistics, and we simply see that people are doing better. And we are now looking for the best cases. And I simply ask them, here, do you want to tell us something about it and simply let people know that it even exists, because they don't even know that it can be treated in this way. Of course, there are limits to gold implantation. If someone has a tumor in the bone, if the bone is completely destroyed, then you can't do it. That's why I always look at the X-rays beforehand and decide, is this a case for gold implantation or not? But if you can do it, which is the case for most people, then it's a great therapy that has the great advantage that you don't break anything, you keep your own joint. You don't feel the gold. Although the gold is inside, you can do an MRI because gold is not magnetic. You can walk through airport security without ringing, because gold is not magnetic. You can basically do any other therapy. No matter whether you are doing acupuncture, whether you are giving an injection, whether you want to make a puncture. All this is possible with gold. And that's just cool.
How big are these gold nuggets? When you talk about it,
These are small pieces of gold. They are about 2 to 3 millimeters long and are 1 millimeter thick, pure gold. And then we put a whole number of them, 50, 60 gold pieces around one knee. So quite a large area. But you don't see them, you don't notice them. They sit in the depths and they don't migrate. We know that for decades, when we've seen, okay, what's happening? We then looked at animals and people. And when I take an X-ray, I can see where the things are. And the radiologist who sees something like this for the first time is often startled and thinks, oh God, we at war, do they have splinters? That's why I always tell people, if you ever have an X-ray, please tell the radiologist that it's gold, because nobody expects that. But the effect is proven. The effect is really cool for many people. I experience this every day with my wife, whose big toe I treated. And she does a lot of sport, she has a karate black belt. She trains intensively several times a week and always had complaints. And since she has gold in it, she can do everything, completely without any pain. Hallux valgus is an issue that many people know. And the burning pain is gone. The pain on movement is gone. I always find it inspiring that you can help people with little damage, even with no damage at all. And if it really doesn't work, you still have all the other options. So you can't do magic with any therapy, there is no therapy with 100% effect. But we already have a large number of patients who then really give very positive feedback. We hear it from the people. We call everyone and find out what's happening.
if you think about it, replacing a joint is a long process, after the operation. Until the whole thing works again, it's a foreign body that I then have in my body. And not everyone, in many cases, people continue to have pain or restricted mobility.
A certain number of patients continue to have pain. In the case of hip joints, it is around 10%, and in the case of knee joints as much as 25% that need to be revised again. And then you can't replace a joint for as long as you like, as they also have a limited holding time. So if I get an artificial hip or knee joint, it will last a few years. Maybe 10, 15 or 20 years. But you can't replace it 4 or 5 times. So the younger a person is, the more likely we are to try to use a procedure that prevents or delays an operation, because you can't change it as often as you like. And then there are also joints that you can't go and replace. So you can also replace a shoulder. But finger joints or, in this case, a metacarpophalangeal joint of the thumb. Sure, they can be replaced by now, but that's all difficult, or on the spine. We have many patients who come to us with chronic residual spinal pain following a slipped disc. Or they have an osteoporosis fracture that hurts, or have a chronic headache due to cervical osteoarthritis. I then put gold in there. Of course I can go there and stiffen it, but the stiffening usually means that the vertebrae that are then stiffened no longer move, but the one above it or the one below it do. This then causes trouble a few years later because it is then overloaded. And these are things where I am of the opinion that gold implantation can really be a very, very helpful, beneficial therapy without destroying anything, without having to replace anything. It's like having third teeth. You chew better on your real ones than on any replacement, and you also walk better on your own joints than on anyone else's.
Yes, you just mentioned spinal stiffening. I have someone in my circle of friends or customers who also had a spinal stiffening after an accident. Is that also something for him? So it was at least painful for him at the time after the operation and still is weeks later. Does gold implantation make sense in such a case?
So if someone needs a stiffening after an accident because something has been destroyed, then they need it. There's no question about that. If someone has a severe listhesis, where one vertebral body slips over the other, then you also stiffen it. But if, for example, there is still residual pain after such a fusion, then it makes perfect sense. We also have patients who come in from time to time and say, "Oh, I have an artificial joint and it still hurts." Provided it's not an infection, the residual pain can also be treated with gold implants. And experience has shown that they go away. Yes, that's also possible. And you always have to decide on a case-by-case basis what is feasible and what is not feasible. I recently had a patient who actually came to me because of a completely different illness, and he had an artificial joint and then told me that he was in pain, whether I can do something about it. But the problem with it was that an inflammation had set in, wherever it came from. And he had to have a new joint, then he got the new joint, then it became inflamed again. Then the surgeon said, "We can't remove it again now." We have now treated him with other procedures so that the inflammation is almost completely gone. It's not completely gone yet, but it's almost completely gone. In other words, I had to take a different approach. I couldn't say, "Come on, I'll put some gold in there." That wouldn't have helped at all because it was simply an infection. Thank goodness that's rare. But you can also treat existing artificial joints if there is still pain. This is always an attempt at treatment that does no harm, but offers a chance of improvement.
Now I'm surprised, of course, because you say your wife already knew this from veterinary medicine. So why, if it is so effective, has it not yet become more widespread? Why is it so little known?
This has spread very well in veterinary medicine. Because no one in veterinary medicine would think of fitting a dog with an artificial hip joint. No pet owner pays that, but they would get 15 dogs for that amount. But gold implantation has not become established in conventional medicine because we simply do things differently in conventional medicine. In conventional medicine, there are always procedures that eventually prevail. In this case, joint replacement. There's a whole industry behind it, people are sent to rehab, etc. It just started at some point. We have seen that it works and has proven itself, and that is why it is done this way. And if you go there today and then introduce a different procedure, there is simply little interest. You just have to say that. It also makes sense to replace artificial joints where there is destruction. There are simply borderline areas where I can't do gold implantation. And that's where I make the recommendation for surgery. But where you can help people, it's a nice process. And when I treat patients with rheumatism, for example, which I have been doing for 20 years now, I can help them to get rid of these rheumatic symptoms by eliminating the causes. By saying, "Okay, I've never seen a patient without lead poisoning, for example, nor a child nor a teenager. And I can see that if I take these things out and also look for pathogens, etc., the symptoms go away." And not claimed, but can be proven in the laboratory. And that is still not state of the art. On the one hand, rheumatism clinics have been sending me patients for years with whom they can't make any progress. And when I treat them, they have the chance to improve because I get to the root causes. But you might ask yourself why they don't go other ways. They follow the paths that are established, that are also paid for by the health insurance companies, that are also insured in the clinic, etc. So it's complex, and that's why we offer a procedure that deviates from the mainstream, but only if it helps. That's always important for me, to see if a procedure works. That's why we ask people, that's why we also carry out statistical surveys in other areas, to see and prove whether it works or not. And if it helps, then the person who heals with it is known to be right.
I have one last question that is burning on my mind before we unfortunately come to the end of this conversation. Gold is a metal, I would say. Do you also have to think about that? That components then migrate, are deposited somewhere in the body like other heavy metals or similar? This is a naive question, but it may be of concern to some people.
That is a legitimate question. So we can also see from the many analyses that I carry out with my patients who have been exposed to the environment that even those who have had gold implants for a long time do not release gold. We don't see anything. So it stays there, it's inert, it's a local effect. It is also not the case that when I treat the knee, which has a chronic inflammation, that the inflammation in the whole body suddenly goes away. We have never seen that either. This really is a local effect that remains local. And if one joint is treated and is fine, and the patient still has a problem at another site, then the other site has to be treated. So it's not a systemic effect, it's really a local effect that runs locally and stays local. The stuff doesn't migrate either. This has also been established.
You already mentioned that.
So yes, it is not a systemic effect. It is also not released and is then stored elsewhere in the body.
For our TV viewers, I would like to ask where they can find you when someone says, "Oh, that would be something. I would also like to get treatment or see if I can be helped."
Either they enter Dr. Harald Burgard Wadgassen and then they get to my website www.drburgard.de. Or they can enter www.goldimplantation.de, in which case they will also end up on my site. Or search for Gold Implantation, Dr. Burgard on YouTube and then see case reports. Several patients have already talked about it.
Very good, thank you, dear Harald. It was again very informative and of course very convincing to hear the patient speak. That's always the best business card, better than any advertisement.
Yes, but that's taken from real life. It's not arranged, it's live.
Not paid.
Neither, no discounts, nothing.
I look forward to talking to you again about the innovations you have. Or your experiences with patients.
With pleasure.
Always enriching and, as we have seen, the client or patient became aware of you through an interview on our station and has now found a solution to a pain problem she has had for decades. Great, I can only say. Thank you, dear Harald, for being here. See you next time.
Thank you very much. See you next time.
Many thanks also to you, dear viewers, for joining us. And perhaps you are also affected and have found a solution here. Just get in touch and we can help you. I'm curious, maybe you'll be sitting at the other end of the screen, like MS. Klunker did today, and then report on your positive experience. I would be delighted, we would be delighted and ask you to be mindful, vigilant and loving towards yourself in the meantime. I look forward to you tuning in again next time. Until then, all the best for you. Ciao.